Hey, everybody. Welcome to the TEConnect podcast. I'm John Martin.
And I'm Dean Reverman.
So, Dean, if I say the word continuum to you, what comes to mind?
Continuum.
Continuum.
Why are you coming at me with like a 5-star word right out of the gate? Continuum.
Like the space-time continuum?
Right? Yes.
Or
Let's go Einstein.
The Q continuum from Star Trek, if you're familiar with that.
No, I'm not.
Okay,
yeah.
well, that's my nerdy side.
But since I've been in this world, meaning BlueStar's world, it has a healthcare connotation.
There you go.
Healthcare continuum.
We're going to talk about a care continuum a little bit today.
There it is.
It's a big part of our conversation. We're talking about virtual healthcare as a service. So the idea of virtual healthcare, maybe a little bit more than what most people think of with virtual health. We got Kevin Leal from VeeOne's joining us today.
Yep, he's good.
We're going to talk about what a continuum is, a continuum of care.
Got it.
How it goes beyond basic telehealth, just a video visit with your doctors that most people probably think of.
Yep.
We're going to get into how it impacts rural health. Rural health is where there can be a real benefit from this kind of service.
Very much so.
We'll talk about remote patient monitoring. Talk a little bit about VeeOne's platform, how they help out. And of course, as always,
can we start throwing out acronyms, by the way? RPM for remote patient monitoring?
You can do that.
Okay.
But we probably should explain those acronyms.
Yes, we should. Yes.
But yes, if you want to feel like you know something on the healthcare side, sure.
I just want to flex. Throw out the acronyms.
Whatever you need to do to feel better, Dean. All that plus our usual value to the VAR and what's tech connecting with us. It's time to plug in and get connected.
Welcome to the TEConnect podcast. It's time to get connected.
All right, as I mentioned, our guest today is Kevin Leal. He is the director of Global Alliances and Partnerships for VeeOne. Kevin, thank you so much for joining us today. Tell us a little bit about yourself, your background in healthcare in this industry, and what do you do day to day?
So a bit about my background. I've been focused on the healthcare market, really launching and selling solutions into healthcare for probably more than 15 years at this point. I don't want to date myself. But I've worked for hardware manufacturers, I've worked for software developers, I've worked in the reseller channel, really all the above. So I've got a pretty good knowledge of how solutions go to market and how resellers can take advantage of those solutions and bring those to their healthcare customers. For one, as you mentioned, I'm a director of alliances and partnerships. What that basically means is I own all of our partnerships, both on the solution side. So if we're partnering with some technology company for our solution, but more importantly, I focus on building out our channel partnerships, right? Companies like BlueStar and BlueStar resellers who would be able to take these solutions and sell these solutions to their customers. So.
There you go. That's the guy with the connections.
I was going to say that he's got the connections, he's got the background, he knows a little bit about every part of the channel there.
Yep.
That's our ideal guest,
value
isn't
of the
it?
VAR, right? we'll get into that.
Yeah, exactly. He should know a little bit of value there.
100%.
All right. Well, hey, let's get into this then. This idea of virtual healthcare as a service. We talk about a lot of SaaS stuff on this show.
Yeah, this is a good one, right?
This is a good one because this is not. People don't think about this in the healthcare space, I think, quite this way. So again, when most people talk about or think about telehealth, the context is probably the video visits.
Yep.
Maybe some very basic, connectivity, like, scheduling appointments and whatnot, reaching out to your doctor, the stuff that we all kind of learned how to do, especially over the last couple of years or so. And it's a little more prevalent than it used to be. So it's the simple stuff there, but that's just one facet of this whole idea of a virtual care continuum. So help us explain a little bit more about that and why we need to help medical providers think beyond their current digital offerings and this basic stuff.
Yeah, I mean, as you might imagine, during COVID, every healthcare organization really quickly launched telemedicine for more outpatient visits, right? They didn't want patients coming into facilities, for isolation purposes and all that. And so, really everyone has those solutions today. When we talk about the continuum of care and what VeeOne provides, what we're really talking about are all the different ways that patients and providers can interact throughout that continuum of care. It could be in that outpatient setting where a patient wants to stay at home, but but connect virtually with a care provider. But it could also mean when patients are in inpatient facilities like hospitals or so forth, and how do they get connected to their care providers, and really providing a way to do that virtually, or provide kind of hybrid care models where that could be an in-person visit where a provider would come to the patient bedside, but it could be a remote provider where you're using technology to connect that remote provider into the patient at the bedside. And then as patients go from inpatient to more of long-term care or skilled nursing, maybe a rehab facility, how do we connect them to the care providers, their case managers, et cetera, that are following up on them and to see how they're doing? How are we connecting to patients once they go home, right? All of those uh, connection points are part of that continuum of care. And what V1 has done is we built a single platform for that entire continuum of care that really connects the patient and the provider, no matter where that patient is in that patient journey.
So when you're talking there, Kevin, you're talking like specialists, right? I mean, I'm imagining a world like if somebody goes in for inpatient care, there's a specialist that comes in to provide whatever service. They're maybe not normally a part of the team, but now they can connect in, right? So that's
Yep.
part of the continuum of care that you're kind of painting a picture of. That maybe that person's across the town, or
Yep.
they came in for the procedure or whatever, but we're still trying to keep those people connected as a part of the group, correct?
Absolutely. That's a big part of inpatient telemedicine, is being able to take advantage of a limited supply of specialist doctors, right? That need to support a larger group of patients. It's just the nature of where healthcare is today. If you've read the news lately, there's nursing shortages, there's specialist shortages, there's primary care doctor shortages, right? It's going to force a complete change in our care model, where all interactions can't be face to face anymore, right? There has to be some kind of a hybrid of face to face and virtual care to support that many patients needing care.
Yeah. And I think one of the drivers, let me ask you this question. Is it true that one of the drivers is cost? We ran a survey, or at least we did an ebook in conjunction with V1, and there were some good statistics in there. It was more around remote patient monitoring, but there's a significant cost savings when you get into some of these virtual cares, right? Whether it's, a per procedure cost savings, or whether it's reduction in how long they're in the hospital, or how long they're in a care environment, shall I say, that is a high-priced care environment. Right. So, Kevin, would you agree? I mean, the cost of what you can get, the cost savings that you can get through some of this virtual care is helping to pour gasoline on it, I guess, in the fact that it's bringing efficiencies?
Yes, yeah, there's certainly much more efficiency with virtual care, as you might imagine. In the case of specialists, right? The specialists don't have to travel around and try to be in front of the patients, right? They can do what we call virtual rounding now, right, where they could be in their home or in their clinic or wherever it may be, and they can see patients, and really anywhere they are. Also, the idea of uh, uh, cost savings, there's a lot to that, right? Certainly, CMS, Centers for Medicaid Medicare Services, um, they've loosened during the pandemic. They've loosened a lot of the billing codes around telemedicine that allows these organizations to now bill for a lot of these services, and that's good, right? They like to collect money because they need to, uh, but also, um, they're learning there's other value that kind of plays into the ROI for these programs, that's really significant, in terms of really quality of care and how that helps them with reimbursement rates and things like that. So there's a lot to ROI, and there's a lot more studies now since we had COVID, that are really telling us of the positive impact of virtual care in our healthcare today.
Nice.
So,
Yeah.
And one of those other positive impacts would be on the patient side, right?
Yep,
Let's
definitely.
not forget about us, the patients. In a part of that survey, 95% of folks were satisfied with telehealth quality. So now we're kind of pivoting, as Kevin just mentioned. It seems like we're pivoting towards these virtual care environments. But part of the reason why that's happening is that people are okay with it.
Right.
They actually don't mind having a telehealth conference for a lot of these, things that you would normally have to drive in. Very disruptive in your day.
Yep.
Very it raises anxieties going in to see the doctor.
Or if you just feel bad and you don't want to go anywhere,
Right?
you don't want to get in your car and have to go to the doctor, sit in the waiting room, wait to go back, sit, you just want to feel better. And if you could just have a call, have a conversation, get some medicine prescribed, and go feel, just stay resting and feel better. That's the whole idea.
So Kevin,
I would think that's what they want too.
Yeah. So Kevin, we're seeing positive impact on the patient side too, as well, which has a positive impact maybe on reimbursements and things of that nature. Correct?
Absolutely. Yeah. The other thing that's happening today is most healthcare organizations have implemented some kind of outpatient telemedicine program, right? Something. And that's fine. But most of those solutions and programs have been focused on the actual interaction between the provider and the patient together. But what about the patient experience leading up to that visit? What about the patient experience after that visit? How does follow-up happen, right? So we can't forget the workflows and making it as easy as possible for patients to actually get to those virtual visits. And that's something that we've been really focusing on at V1 is how do we make it super easy for the patient? Literally, it's a single link. You click on the link and you're joined to the visit. Some of these other solutions require you to download a web app and do this and do that. As you might imagine, some patients are just not there, right? They can't do that kind of stuff. So
Yeah, you got to be able to match that convenience factor there, for some folks too.
100%. And everything that we're talking about here really is solidifying in my mind that virtual care continuum, right?
Exactly.
It's not just one-off on a particular procedure or whatever, or a telehealth visit. It's the continuum.
Right.
It's pre, it's during, and it's post. And it's even more than that probably, right? It's ongoing type of thing that we're talking about as well.
Yeah. So, let's talk a little bit more of some of these statistics here, because again, when we did this marketing campaign with you guys, and as I was putting together stuff for the ebook and looking at all the stats out there, I was fascinated by, because this was one of those topics I didn't know a lot about to begin with either. So as I did the research, I found some interesting stats about how this can benefit, again, beyond just the standard telehealth protocols that we think of, the outpatient video visit stuff.
Right.
So I want to get into a few here, especially as related to specialized care. So one of the things, a large Florida healthcare system showed that telehealth implementation reduced ICU mortality from 10.7% to 8.6%. Which, you may not think that's a big number, but when you're talking mortality,
that's huge.
That could be a few thousand people, and that's always a good thing if you can save a few thousand lives. Plus,
Lord,
we all know, and this is one of those things that whenever I talk to anyone who works in healthcare, they struggle with the idea of, patients that don't keep up with their health care. So you may see somebody, maybe you diagnose them with some kind of a chronic condition or an ongoing condition, and really to live longer and to manage it, all they need to do is keep up with their visits, keep up with their medication.
Right.
And that can be where so many people fall off, and suddenly you have higher hospital readmissions. You have all this kind of stuff happening that is, that these patients are getting harmed or, potentially dying down the road because they're simply not keeping up with their health care.
Yeah.
And if this is one more way you can get people to keep up, why not? So a couple other stats that popped out to me, a 53% reduction in ambulance transports to urban emergency departments after implementing telehealth emergency services. That's huge. And then one that really stood out, the American Hospital Association estimates about 20% of Americans live in rural areas without easy access to primary care or specialist services. According to the Census Bureau, only 12% of primary care and 8% of subspecialists practice in these rural areas. So you mentioned earlier this idea that we're talking about, it's not just the, your standard doctor, your physician you've been seeing for a decade or more.
Right.
We're talking about specialists, maybe a cancer specialist, some kind of specialist that you normally you see for certain reasons, and is not someone who's just available locally to. You might have a local hospital, but that doesn't mean they have all the people that you need there.
That's right.
So help us out with this, Kevin, here. How does, creating this continuum of virtual care, how does it close that gap for those rural patients to make sure that they're not getting left behind and those numbers are improving the way we see here?
Yeah, a perfect example of this is critical access hospitals. So critical access hospitals is a special designation of hospital. They can have up to 25 beds. But they're in, as you might imagine, rural areas, right? So you're not going to find a lot of neurologists and cardiologists and pulmonologists, et cetera, even behavioral health workers in these rural areas. It's really hard to find them. So these critical access hospitals either have to do one of two things. They either have to transfer patients out when that patient needs specialist care to an urban hospital, and that takes that patient away from their family, away from their community, right, or their support, right. They're now distant, right. So the other thing they can do is implement a telemedicine solution and contract for these specialists. V1 offers these specialists as well, um, so that we can make available to these small rural hospitals, cardiologists, pulmonologists, infectious disease doctors, behavioral health workers, whatever it may be, to keep these patients in their local hospital with their family. And there's just huge ROI, right? I mean, these small hospitals can now continue to bill for providing care to these patients, and that's what's keeping the lights on for these small community hospitals, right? They need that revenue to keep the doors open.
For sure. 20%
Fantastic.
of Americans live in rural areas. That's a lot.
Yeah.
Right? I mean, that's a huge part of the population that underserved on the specialty and things of that nature. So it seems,
Well, and it's probably going to keep growing because I think we went through this period of kind of contracting where people kind of went back to cities
Yes,
again.
right.
And now you're starting to see it go the opposite
Yep.
way again, where people are starting to expand back out.
Absolutely. Yeah.
So
I can work from
imagine that number's
anywhere.
gonna yeah, exactly.
I can work from a farm field in Iowa. So
that number's
why
going to
not?
grow. Right.
Yes.
Exactly.
Yeah, community health centers are another perfect example of that. There's community health centers focused on urban areas, but there's community health centers focused on rural areas as well. Same thing, right? There's a shortage of primary care doctors, right? And there's not, especially in rural areas. So being able to get access to primary care doctors and other care providers, primary care providers, for these rural clinics is huge for the patient population that lives there.
Really doing a lot of good.
Oh, yeah,
I mean, I
definitely.
don't know how else we would expand this service without doing it in a virtual type of environment, right?
Right,
This is
right.
definitely one of the positive areas where technology is going to have a positive impact
Yep.
by servicing those communities.
Yeah, and again, helping families feel more comfortable about their loved ones being in
Absolutely.
some of these critical access places. Especially, my wife has in-laws and family, extended family that live in rural parts of Tennessee, and they're always terrified when one of them has to go to one of the local hospitals. They just don't have the kind of resources that you have in an area like this or around a big city, and it'd be nice to know that there's they can feel a little more comfortable about that. That hey. Yes, our loved one's in a place that is, doesn't have quite the same resources, but they have ways to get those resources to them, even if it doesn't mean someone has to trek their way, a couple hours from another hospital to come there all the time.
That's right.
So,
Yeah.
Absolutely.
all right. Well, let's get into is Dean. You mentioned an acronym up front here.
Yes.
RPM.
Oh, yes.
Or remote patient monitoring. It's a popular topic in healthcare lately. Again, especially coming through this whole pandemic, this idea of not having to bring patients in to facilities to be seen where they can be exposed to COVID or anything else, frankly, for that matter. So tell us a little bit more about what RPM entails and why are the benefits of this so significant?
Yeah. Well, you mentioned it earlier, right? That we have, unfortunately, we don't have the healthiest of nations, right? So we have a lot of patients that have chronic conditions. And a way to support those patients is to send home a kit to them, right, with some monitoring devices, so that we can understand from a day-to-day, hour-to-hour perspective, kind of what's happening physiologically with their body, right? And we can kind of measure that and monitor that and alert on that. All of that's been around for actually quite a while. There's a lot of solutions out there that do that part. The hard part, I think, is making that data that you're producing actionable, right? And creating workflows where we can take an alert, let's say, and a case manager sees an alert for a patient, and they can actually take action by clicking on a link and then connecting with that patient virtually and ask them, hey, how's your day going? I'm seeing some unusual data, right? Tell me what's happening with you, right? Did you get any sleep last night? Whatever it may be. Um, and then being able to bring in other care providers, maybe their primary care provider, their family members, right? Bringing in quickly their family members into a consult to say, hey, what's going on with grandma, right? And all of that, I think, is a way to really do effective population management. And that's what organizations, these hospital systems, healthcare providers are responsible for these days. This move to population health management, they're responsible for the population they serve. It's not just about um, when patients come into your facility, I'm responsible. Well, no, you're responsible for their health when they go home. So this RPM stuff is really important, and it's important to really have a solution that can be actionable, I think.
So let me ask a couple questions around the actual, like the kits that you are referring to.
Yep.
What are you seeing in the marketplace as the acceptance rate of that? Meaning the technology's there, right? I mean, we've got the technology that the patient can be at home, but they still have to quote unquote hook themselves up to certain devices and things of that nature. What have you seen in the marketplace? Is it 50% of people do that? Is it a lower percentage and we just need people to understand that, that it's better? Or what's some thoughts there?
Yeah, and I don't know the exact percentages, but there is there is an issue with having patients continue on the program, right? And continue to use the devices and remember to use the devices, and particularly with an elderly population, right? Do they have the technical ability to use the devices properly? And I think the important thing here is to really provide kind of a care team around that patient with their family, so that they have the support and the help to kind of keep them in the program and make sure they're using the devices correctly. Of course, V1 has a team that supports these patients as well, but it's always good to have family members there to support them and make sure that their family member is doing what they need to do. They're taking their meds or using their devices properly, all that kind of stuff.
Yeah, that makes a lot of sense, getting the family involved. I thought you were going to go down like a robotics angle, like, oh no, we're developing the robot that's going to be at home and it's going to
drone's going to come over and
it's just going to keep
medicine.
following grandma around until she takes her medicine. You need to take your medicine. You need
Yeah. Well, there is technology for that. There's technology for that. There's pill boxes, right? That are electronic pill boxes, Bluetooth pill boxes that will tell you when to take your medicine, and if you took your medicine, all that kind of stuff. So
once again, I love the family angle here and the idea of being able to tap into someone. And again, I'm thinking of, like, let's say you have a family member at a distance from you, someone that, they live in another part of the country or another state from you. And, in times of crisis or medical emergency, with an older family member or something, you might have to have someone in the family that has to, like, leave their job for a few months or something, or move entirely or make different arrangements so they can keep up with them. But, if you're able to say, hey, you can stay where you are, keep your daily life with minimal interruption. We'll just be able to tap you in a little more often to help out with, with questions, with, decision making, with, as you pointed out, like, hey, we're noticing some stuff's going wrong here. Can you reach out and ask some questions and make sure they're staying on top of this? I mean, I think for my mom, even though, she's not in any kind of assisted living or anything yet, I'm already at a point where I pretty much manage her, her charting, I tap into her EHR or whatever, and look through all of her chart stuff or whatever, what she's been doing with the doctor in order to make sure that she's on top of appointments, medications, all that stuff. It's nice to have that option to do that. And again, I would love to, if something else were to happen, to be able to have that more connectivity to stay connected to what's happening at all times.
Yeah, absolutely.
And I think it's hugely important to have the family members part of the care team with the care provider, right? So how many times have you had a relatively, say, an elderly patient where they go to them, maybe a sibling takes them to an appointment and comes back, and everyone's asked, so what did the doctor say, right? So you're asking the patient to kind of remember everything the doctor said. Well, why not have a family member participate with the care provider so they all hear the same thing, right? So
agreed.
Hugely important.
Hugely important. Absolutely. I mean, how many times have you come back from the doctor, after, and you don't remember all the information? Yeah. Oh, it happens all the time. But there is another statistic, that came out in the study that you cited in this marketing thing, the ebook that you created, when the University of Virginia Center for Telehealth reported hospital readmissions decreased by 40% just by using remote patient monitoring programs. Hopefully they had programs that involve the family and stuff like that. But man, that's a huge benefit, right? 40% less readmins. That's
That's
like
what it's all about.
nirvana for a hospital.
I
They
know
don't want
everyone,
you to-
right? I say I know everyone thinks like, oh, the hospitals want to get as many people as possible to spend as much money as possible and rack it up, but there's a lot to de-incentivize them from readmissions. That's not helpful. Like, sure, they get what they get out of you when you come in to begin with, but there's a failure level that they've achieved if they're doing something that you either you get sepsis or for some reason you have to be admitted again. That's seen as a failure on their part. That doesn't look good. So
that's correct.
They don't want that to happen. They want to take care of you one and done and get you back to your health. Not to mention, word of mouth. If you tell somebody like, well, I went to the hospital to do this thing and I had to go back, 3 months later because something went wrong. They'd done something wrong. They left a sponge in me. I don't know, who knows what kind of stuff, so you don't want that to happen either.
No, for sure.
All right. Well, hey, Kevin, let's you've already referenced V1 quite a few times here and kind of what you guys do and some of the little bits and pieces of things you have to help out here. But let's bring it all together. Give us a little rundown of the V1 Health platform, this whole idea of the care continuum, how you guys fit into it and how you help address these topics we've discussed already.
Absolutely. So our platform was really built by doctors to be as easy to use as possible and to be kind of a single pane of glass that the patient and the provider use, no matter what the use case scenario, no matter where they are in that continuum of care, right? So that's definitely unique about our platform. That's different from our competition, right? It's a common single platform, not acquisitions bolted on. It's all one interface for the patient, one interface for the doctor, and around all that continuum of care. That patient could be at home, that patient could be in a clinic, that patient could be admitted to an inpatient facility. It's all the same interface. And it was built really to customize those workflows for the clinicians, because what we've noticed is that every single health system you might go into, their workflows are going to be slightly different, right? So we have a very customizable workflow around how the provider, how the patient get to that virtual visit.
And then you also have resources that you can draw on as well, like with your your Vigo 360 and things of that nature. It's really kind of a holistic solution, which is really kind of cool. So, Kevin, talk to us a little bit about the reseller community and how you work in the channel. If you could just address that a little bit, because we've got resellers listening to this. Some may be in healthcare, some maybe not, but a lot of them do serve rural areas, and maybe they want to approach some of the facilities in their area with this type of solution. You guys work with resellers, correct?
Absolutely work with resellers. That's my job. I wouldn't be here if I didn't. So, So there's a huge opportunity for resellers here. What I will say is this. If you're asking really basic questions like, hey, do you guys already have remote patient monitoring? The answer is going to be yes. Or if you guys already use telemedicine, the answer is going to be yes. That shouldn't stop a reseller from digging deeper. All we really need from a reseller is to start a conversation and bring us in. Let's set up just a discovery meeting with your customer, asking them about where are they in their virtual care journey, right? Tell us about what you guys did in COVID, what worked, what didn't work, what do the clinicians think? Is this working for the patients, right? What use cases have you rolled out? There's a zillion use cases for this stuff, and I guarantee you no one's rolled out them all, right? So there's all kinds of opportunity for a reseller to sell telemedicine solutions to organizations that already have telemedicine solutions. The other thing I will say is that there's, especially during COVID, a lot of organizations rolled out a number of different types of solutions, and some organizations may have multiple solutions in different parts of their organization. What we're seeing now is a desire by the clinicians to create a single platform for this stuff, right? So they don't have to use multiple tools depending on where that patient may be or the workflow they may be trying to execute. So they're trying to change from going from 3 systems down to 1, or their contracts are coming up for renewal and they're looking for alternatives that are maybe less expensive, or the IT team doesn't want to buy custom telemedicine hardware cards and rent those from a solution company. They want to drive these solutions based on standard IT equipment. All of those things are opportunities. All of those things that we can help with, and we have our own sales force that works with the channel that we can help you every step of the way. from how to run a discovery call, how to prospect, how to market, how to develop a proposal, all that stuff. And by the way, everything is available through BlueStar. Everything's been skewed up, available through BlueStar.
Really good where you were going there. I can just imagine, when the pandemic first hit, you've got all these health organizations that just went scramble headlong to get to get all these things, telehealth and all these things. Imagine these Frankenstein systems now that are out there, right? You've got something over here, something over there. I think your point is really valid there, obviously, Kevin. And how can you bring that together? Well, I mean, a solution like V1 really is a great answer for that you can walk in with that holistic solution that's going to take that Frankenstein system that they have today and bring it into a manageable, I love the one pane of glass, I'm going to use that, type of solution that obviously everybody's looking for, right? I mean, that's our world today. Nurses don't want to use something where they got, 5 different devices here and 8 different things to log on there. They want simplicity. So do the physicians. So it's a really great solution on that end. Yeah.
And I give you a great example of this. So we have we're working with a hospital system. I think it's 11 hospitals in Washington State. And upon discovery, they thought they had 6 different telemedicine systems deployed across their 13 hospitals. Upon further investigation, they have 11. Right, 11 different systems. Right, so they have 2 different solutions in different hospitals for the ER. They have a couple different solutions in their ICUs. They have a different solution in their outpatient clinics, right? I mean, just imagine, right? And so what they're trying to do now is they're trying to develop a strategy where they can consolidate and choose the right tool and deploy that, and then and make it easy for the clinicians, make it easy for the patients. These workflows, these UIs are all common. So that's what they're trying to do.
Brilliant. I can I knew it's happening out there. And there's the opportunity. And I think that V1, what Kevin just mentioned, maybe a little bit, we could expand on that a little bit. They do have the support structure in place to help resellers understand what's going in so that they can get the message down, have the talk track, get the meaningful conversation going. Oh, by the way, when it starts getting to a point where they need to pull in the V1 specialist, not a problem. They have that ability to bring them in the conversation. At the end of the road, what you're trying to do is get the sale. If you're a good old trusty dusty hardware reseller, that's cool too, because they'll be consuming ruggedized mobile computers, things of that nature, or carts. They even got the V cart over at V1 where they can, they have a cart solution. So there's so much more there. You just need to have the conversation. The opportunity is definitely there.
I completely agree. And again, I can't speak highly enough of someone who's able to help you go to somebody and say, hey, what do you have right now? What are these pieces? What is that piece? How are you doing this? How are you doing that? What are you not doing? What would you like to be doing? And then to say, you know what? I think we could get somebody that could actually do all of this for you. Would that work for you? Would you like that if we could bring all this stuff together? You said you hate how it's in 5 different places. You wish you had this. You wish you didn't have to do that. What if I could bring somebody in that could bring all that together? For that, to me, that's sales gold. Like if you've done your work and your diligence and had your consultative conversations and understand their current pain points, and you can bring in one solution provider, or you can be that solution provider because you have this partnership, and you can bring it all together. That single pane of glass. You're right. It's a great little catchphrase there. I think this is a perfect way to describe that. We kind of already basically covered our value to the VAR, I think, here in this section, because this was kind of what I was saying is the idea of like, how do you get to those opportunities? What do you have to add there, Kevin?
Yeah.
Well, I will say there's a little bit more on the value to the VAR, right? Remember that these are solutions that are really good margin solutions, that they're recurring revenue solutions. Yeah, even small to medium-sized hospital systems can get to multi-million-dollar contracts pretty quickly. We're seeing huge land and expand opportunities. Most organizations start with one use case, and once they start using our platform, they start thinking of use case number 2, use case number 3, use case number 4, and so these contracts, these recurring revenue contracts, just grow and grow and grow. So it's a really huge, nice margin, great recurring revenue opportunity for resellers.
Love it.
Bingo. If you have a relationship at all That's
Right,
kind of
right.
the gold right there, right? Then you need to start bringing in the V1 people as well. And if you're worried about some of the typical technical issues like connecting to an EMR or EHR, Kevin, maybe speak a little bit about this. I mean, the platform seamlessly implements into most facilities, right? So there's really
Yep.
not a lot of technical challenge here. It's just
Yep.
it's a sales and marketing function to try to expose the opportunity and figure out the right solution, right?
Yeah. We're natively connected into Cerner and Epic. We're in their environments. We have native applications in both. Um, we've integrated with other EMRs as well. I mean, EMR integration, maybe 10 years ago used to be, oh, that's going to be hard. It's not anymore. I mean, it really isn't. What it really is about is understanding what workflow the clinicians want. Where do they want to do their documentation? Do they want to do their documentation straight into the EMR? Some do. Do they want to do the documentation in the V1 platform so they don't have to have another application open? That's fine too. All of it's going to end up in the patient record in the EMR.
Good
Love it.
stuff.
Yeah, no doubt. And I will say also, if you're looking for a way to kind of help you push this conversation along, or at least get somebody thinking about it, maybe that you can't have the in-depth conversation you'd like, I will drop a link in the show notes to that ebook that we worked on together.
Yeah.
Highly recommend.
Good stuff in there. Good
It is.
stats.
There's great statistics. It
Yep.
covers the topic really well. We had some really good feedback on it when we ran this campaign. Lots of people were interested in the ebook. So check out the link in the show notes. Send it to any of your customers that you think might be interested. Is a good way to start this conversation with us when they have them check that out and maybe give you some feedback on what they saw in there. So,
Yep.
All right. Well, hey, before we wrap up with what's Tech Connecting with you, I want to, as always, thank our TEConnect program sponsors, our TEConnect members. You help make the podcast possible. We
Absolutely.
appreciate your help. Big thanks to Zebra because I know they introduced us to V1
Yes.
and it helped us out with that campaign. We appreciate them bringing you to us and
Being a
obviously-
long-time sponsor.
Exactly,
Yes.
a long-time sponsor and helping us get Kevin on the show today.
Yep.
As always, if you like our program, if you're watching us on YouTube, hit the like button to this
Yeah,
episode.
give us a little rating.
Give us a rating. Drop us a comment. We want to know what you think about it. Make sure you
Absolutely.
subscribe to our channel so you don't miss out on this or any of the other great content we're always throwing up there. If you're listening to us on an audio platform like Apple Podcasts, Spotify, Stitcher, whatever, if you have the opportunity to leave a rating or review, please do that also. That's how we know what you think of the show. We get your feedback. It also helps other people discover the show and just decide if they want to take a listen.
But what if they got an idea?
Okay, well, if you got an idea for the show, if you have a topic you want to hear more about, maybe you're thinking, hey, bring Kevin back on. I want to talk more about XYZ of
RPM.
healthcare. RPM, there you go. Then you can let us know that too. There's always a link in the show notes to drop us a topic submission. You can tell us what you want to hear about on the show. If there's a certain guest you'd like us to try to find, if there's a certain industry you want us to dive into more, if you have a tech connecting you want to share with us, share it with us there. Just for doing it, just for sending us a submission, even whether we use it or not, we will send you a Tech Connect podcast T-shirt.
There you go. What more could you want?
It's no work, no real work,
no
other
real
than
work.
a few moments,
a little
of
bit
your
of
time.
thinking, a little bit of typing.
Yeah, exactly.
Boom.
And you get a free T-shirt.
Sure, comes in the mail.
Who doesn't want to do that?
That you would definitely wear.
Exactly.
100%.
It's a very comfy, nice T-shirt. You're going to want this one. So
doubt
go
about
to
it.
the show notes, check out the link. If you're watching on YouTube, sometimes I have a link that goes to a different page with all the notes so that you can see all the hyperlinks there. So definitely check this stuff out. There's good stuff there that you can use not only for your work, but also if you want to stay in touch with us. And of course, as always, you can find us on Twitter at TechConnectPod. You can also email us, techconnect@bluestarinc.com. All right, let's wrap things up here with our fun segment. What's Tech Connecting with you?
Yes.
This is where we get to talk about something in the world of science, tech, business, innovation, the news,
right.
just something that's got our attention we feel like talking about right now.
Fair enough.
Kevin, I'll let you kick off. What's Tech Connecting with you right now?
A couple things are really interesting. So there's been some major developments and continue to be major developments around biostickers. I don't know if you've ever heard of biostickers.
Tell us more.
But these are little patches that patients can put on their bodies, right? And it does continuous monitoring of any number of different physiological measures, right? So we were talking earlier about remote patient monitoring and having to use devices and figuring out how to use Bluetooth devices, all that kind of stuff. Well, this kind of eliminates all that. These are small little Bluetooth devices, and they're worn for up to a month. Some are worn up to 2 months. And that, you shower with them, bathe with them. They're on your body and they're continually monitoring. So those are pretty cool stuff.
Nice. Yes.
Love it.
The other thing that's kind of interesting is the use of autonomous robots in healthcare, right? And so we're actually developing a solution right now that's taking advantage of an autonomous robot. And so imagine if I'm a remote provider and I want to check in on a patient in a given room, and let's say this care provider they didn't outfit their rooms for telemedicine. Some, a lot of people haven't, but even though that's happening, you can actually beam into this robot, tell them, robot, go to room 304, bed whatever, bed number 2, and go, and it'll go. And once the robot's there, it'll check its signal with the patient, and then it'll beam back to the doctor and join the doctor in, and they can do a consult. And when it's done, the robot goes back into its docking station and is charging up for the next task.
Brilliant.
So pretty cool stuff.
That is pretty cool
Love it.
stuff. I know exactly kind of what you're talking about because we used to have one of those little, it was called a double robot, and it was just an iPad on some wheels, basically.
Yeah.
But you could drive it around,
Yeah.
but it was somebody driving around. I love this idea, or, where the specialist, that remote specialist can just dial in. Oh, no, I want to see, quote unquote, that patient, that whatever. That's really cool. I like that. Yeah. And the first one that you had with the patch, well, that thwarts the whole thing that I was talking about. The compliance. You just slap a sticker on them before they leave, and now you're remote monitoring.
Leave this alone,
whether they know it or not.
I want one of those buyer stickers that when I get, when I decide to get McDonald's for lunch instead of something healthier, like tells me like, no, just
something.
Exactly, just a gentle little nudge, like maybe gives me a little bit of heartburn. It's like, no, don't do this.
Yeah.
You're gonna regret this.
Yeah. You'd be okay with that.
No, probably not. I'd probably rip it off within a day, let alone a month. When it tells me everything I'm doing is wrong. Yeah. All right, Dean, go for it.
I got two of them here. The first one's very, very quick. China plans. I got to talk about China. It seems like
you
almost
always
every
have the
day.
China news.
China plans cloud seeding to protect grain crop from drought. China says it will try to protect its grain harvest from a record-setting drought, by using chemicals to generate rain.
Okay.
Does that feel right? We're going to use chemicals to generate rain? I don't know. I'm just going to let that sit there.
Yeah, usually chemicals and plants don't go well together.
Yeah,
but,
so they were talking about things that they would spray on the plants that would absorb moisture. And I'm thinking to myself, I don't know. I don't know that this technology.
I guess it depends on the chemical, but
okay, I don't know. That just the phrasing, like they need to use different words than chemicals, to form rain. I mean, I'm just imagining people running around throwing chemicals up in the air, trying to make it rain, and it's like having a far worse environmental impact. Do you think really China cares? I don't think so. Anyway,
what about bioengineered droplets or something like that? I don't know.
Much better. So you must be in marketing.
Means the same exact thing, but just sounds better.
Then in San Francisco, a restaurant is run entirely by robots. Now, I know that you've seen some restaurants where there's some robotics. No, this is called Mesli. It looks like kind of a shipping container, really nice shipping container, but about that size.
Right.
Think about that size, painted, beautiful, California look to it, if you will. But everything in it is completely robotic. There is no human around. So you walk up, it's a kiosk, as you can imagine. But it's very Jetsons after that. Little tray pops down, dumps some, what did you order? Rice, boom, 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 boom. There's no humans, there's no nothing. Everything is completely robotic. So they're billing it as
Who do you complain to if you don't like something?
Yeah, nobody. There's nobody.
Which I'm sure that's the idea.
Mesli is basically a big refrigerated box with a bunch of machines inside of it. No humans required. They're launching it, and we'll see. I don't know. But, here's another. Oh, of course it is. It's like 3 students from, where are they from? Oh,
MIT or
it's like Stanford.
Stanford.
3 Stanford students who were sitting around at a bar one day, and they figured that they would figure this out.
Right.
And so that is. So Mesli, if you see a Mesli around, it's just a big refrigerated box that's completely automated.
There you go. There was an episode of the rebooted X-Files from a few years back that featured a autonomous restaurant like that.
There you go.
I guess it was probably just an idea that maybe they saw that. Maybe they were like, all right, that's cool.
Maybe we're getting back to closer to your Star Trek world. Weren't you talking about? Isn't it on Star Trek where they walk up and then boop?
They have like the replimat.
That thing.
Yeah, that just create something for
Makes a
them.
chicken wing out of nothing.
Yeah, I want a chicken wing with, barbecue sauce and buffalo sauce or whatever. Yeah.
Well, all right, so we're getting a little closer to that
Maybe.
with Nestle.
Yeah.
So what's tech connecting with you?
All right. You've heard of Janet Jackson, of course.
Of course.
You've heard of her song, her famous 1989 song, Rhythm Nation.
Yes, of course. Yeah.
Well, did you know that song apparently can wreck a hard drive?
What? No.
So this was something I
You
randomly
said
heard
wreck
about.
a hard
Wreck
drive.
a hard drive. I randomly
Okay.
heard about this on a podcast recently that apparently Microsoft is sending out some warnings about a vulnerability for one of their widely used 5400 RPM laptop hard drives sold around 2005.
Okay.
So it's a spin disk. It's not, unlike the modern solid
SSD,
state.
solid state, yeah.
Exactly. It was a spinning one, so, a little
Yeah,
bit
of
older
course.
model, but still in use potentially in some places.
Oh, of
Somebody might
course.
still have
Yeah,
some of
yeah,
these
yeah,
older
yeah.
devices. Well, apparently, if you are just by playing Rhythm Nation on or near a vulnerable laptop, the disk can crash and take its laptop down with it.
What?
The flaw, which has its own CV vulnerability tracking number, is due to the fact that Rhythm Nation inadvertently produces one of the natural resonant frequencies created by the movement in the hard drive.
Oh, I see. So it's like it's an acoustical cancellation,
Yeah.
if you will.
But how nuts is that?
No way. That is nuts.
I want to know. I want to be the person who figured that out. I want to know who was like just jamming to 1989's Rhythm Nation
And the hard drive crashes.
near their 2005-esque Microsoft
they
computer.
replicate the whole situation,
Yeah.
and it keeps crashing, and they're
Figure-
like, I bet you it's
Figured
Janet
it out.
Jackson.
Yeah, exactly. Who knew? I mean,
How
we knew
many?
Janet was ahead of her time. We didn't know she was like 15, 20 years ahead of her time,
Oh,
obviously.
see, now wait a minute. Is there some conspiracy here? Is
don't
there
know.
some government thing going on here where like Russian or the Chinese are trying to wreck our computers by bringing
know.
back Janet Jackson?
Maybe that's the next thing. Maybe people are going to figure out how like certain songs can wipe certain things or something. We'll
Kevin-
reset us all back to zero just because, I don't know, we play Coldplay too loud some one day or something.
Kevin, have you been playing Janet Jackson Rhythm Nation a little loud at home?
I have not.
Oh, okay.
No.
So you're good. Your computers are good then.
I'm pretty sure it did. Yeah.
Now, granted, it was a pretty slamming album. I do remember that being a great album. I feel like I need to revisit it, but I got to be careful.
Be very careful.
I don't think I
Only
have any
solid
2005 devices around anymore. So,
I think I got a spinning hard drive at home. For
do you?
sure.
All right,
I
you should try this out just to see. If,
I think
just
I'm
see what
just for-
happens.
yeah,
just
for the fun of it.
For fun of it, yeah.
Why
exactly.
not? I'm doing it. Yep, we're doing it.
All
good
right,
stuff.
that does it for us today. That's what's Tech Connecting with us. Kevin Leal from V1. Thank you so much for joining us.
Thanks, Kevin.
Thanks, John. Thanks, Dean.
Hey, until next time, stick a bio sticker on.
Yes.
Listen to some Janet Jackson.
Yes.
Again, just be careful about your computers nearby. And as always, folks, please stay connected. TEConnect Podcast is brought to you by ELO. Enhance patient care everywhere that it matters. ELO offers touchscreen product solutions for a variety of healthcare applications, ranging from nurse stations and patient education to patient check-in and pharmacy check-out. Streamline healthcare administration and enhance the patient experience with ELO's versatile solutions. So obviously, if you're looking to build a continuum of care, touchscreen technology is pretty vital to that.
You would think so, right? Yeah.
That's what people are comfortable with, familiar with.
Absolutely.
You know.
Interactivity in that continuum is always a good thing.
There you go, exactly. So ELO's healthcare solutions include the M50 Android mobile computer, O3 series medical grade monitors, large format signage, all-in-one touch computers, and much more. To learn more, visit ELO's microsite on BlueStarInc.com or contact your BlueStar account manager. The TechConnect podcast is brought to you by Zebra. Tough is easy, tailored is critical.
Oh, very nice.
I like that.
I do.
When your customers are out to set a higher standard, they need a tablet that's not only rugged, but also smart and tailored to their way of working. One that doesn't force them to adjust their processes or goals to accommodate the limits of its own abilities. For Zebra, toughness isn't the end game, it's just the starting point.
Ooh.
Table stakes for a purpose that is far-reaching, high-achieving, and uniquely defined by them. Is this an ad or an inspirational speech for a sports
I'm a
team?
little inspired here right now.
I know.
Yes, this is awesome.
Let's go, everybody! I feel like I should have been reading that in an entirely different voice. You know?
Your ruggedized tablet, yes.
Yeah.
Tough is easy, tailored is critical.
It's time to help your customers power their job performance. Zebra, you can use that if you want. and career aspirations to their highest level with a purpose-built Zebra tablet that's perfectly matched and personally customized to work their way. To learn more, review Zebra's rugged tablet portfolio, including the ET series, which are perfect for healthcare, and use their selector tool by checking out the link in the show notes.